We are speaking today on Contours to John Hampilos. He is from Little Brook Nursing and Convalescent Home and occasionally drops by WNTI to give us very useful and helpful tips on elder care. And today the topic has to do with adult daycare for those you care about. And welcome back, John.
Thank you, Mel. It's a pleasure to be here again.
Now, adult daycare is something that my generation never, growing up, we knew about infant daycare and early childhood daycare, but then all of a sudden adult daycare started popping up and it's invaluable to some people. Mm-hmm. So please explain to the listeners about adult daycare. Take us through exactly what it is, who may need it, who may not need it, and give us the story.
Sure, it's my pleasure. Mel, over the past 50 to 75 years, the family dynamics have changed. Whereas in the early 1900s, there was usually one sole provider in the family. Now we have two sole providers. Everybody has opportunity to work. And as such, whereas historically we've had daycare for children, as you mentioned earlier, we now need daycare for our seniors as well. Because our seniors are living longer. They're living beyond the 65, 70 years, well into their 80s and some into their 90s. And we have centenarians as well these days. And some of these seniors really can be almost independent, but during the day, they may need some kind of oversight. And so we've seen over the past 2 or 3 decades a springing up of adult daycare centers. And these are really, really important because we have seniors who, as I mentioned earlier, may need some therapy or emotional support, have some physical disabilities or limitations, may not be able to cope with daily tasks. And with family members working these days, they need some type of companionship and stimulation throughout the day. And so what's happened is that 2 types of adult daycare centers have cropped up. The first one is more of a social daycare type of facility that provides meals, social activities, and some healthcare services, maybe a blood pressure read, et cetera, once a week or so on and so forth. And usually they're open from, let's say, 7 in the morning till 8 or 9 in the evening, and allow us as providers and caregivers to drop off a family member in the morning on our way to work and pick them up in the evening on our way home. And it's really quite a benefit. There's a different type of adult daycare facility, which is called a therapeutic daycare facility, which offers the same thing as a social daycare facility, but for those who have more medical needs, offers additional healthcare services. Now, these are not designed to substitute the type of care the person would receive in a nursing home, but help in managing their medications, for example, making sure they take them in the morning or afternoon at lunch or at dinner time, helping them to sit up and participate in other activities, taking their blood pressure readings, temperature, for example, so on and so forth. And so you have 2 types of daycare facilities, social and one that's called therapeutic, that helps folks like us in our 50s and 60s who may have a loved one or a person for whom we're responsible to have care during the day while we're working.
Mm-hmm. Yeah, and again, the last time we spoke, we went over the checklist of what to look for when you're choosing a nursing home or skilled nursing facility. Would the checklist for picking an adult daycare center be basically the same?
It would be similar. I mean, clearly adult daycare center does not and should not provide the services of a nursing home.
Correct, yeah.
A licensed skilled nursing home provides services, medical services, nursing services, dietary services, and just general, environmental and health and well-being services that an adult daycare situation cannot provide and usually do not provide. But some of the questions that you would ask of a nursing home, you would definitely ask of a adult daycare center as well. For example, first and foremost, is the daycare center for seniors certified and licensed by the state? And ask to see if they have that certification on file. Number one. And number two, importantly as well, related to that, is how long has the establishment been in business? Is it only a few years, or have they been in business for the past 10 or 20 years, which would establish a track record for them? And once you get beyond that and you've identified a facility, a place, a daycare center that can help during the day, ask, the basic questions about the staffing, how many people oversee the seniors, what type of activities they're involved in, what type of food might be served, and check out the facility. Go and visit the facility. See how the staff interacts with seniors who are there during the day. Ask for referrals as well. Referrals are critical. Talk to previous attendees of the daycare facility. Talk to their family members. These are all very, very critical. And we refer you. You can use the same checklist that we recommend for nursing home facilities, for daycare facilities as well. And we can refer you to littlebrooknursinghome.com, and you'll find at the top one of the tabs will have a checklist, and you can print that out and go into these daycare facilities and ask the basic questions that you would like answered.
I mean, I would think you may even be able to find one that your loved one might already have a buddy that goes to.
Sure, absolutely. And there are facilities, there are care centers, the YMCA, YWCA may be sponsoring, for example. There are others that are for-profit as well and offer fine services. But again, these are for basic social services and for basic medical needs. They're not to in any way replace, for example, care that might be done at home privately or care that might be provided by a licensed skilled nursing home. And, there may come a time where your loved one or the person for whom you care will need a skilled nursing home. And some of the, obvious criteria are, is the person falling more frequently? And if they are, get them into a home where those types of falls can be somewhat averted and prevented. Does the person present with bed sores? Are they lying in bed too long during the day, unable to get up out of a chair? Skin does break down. The skin has a layer of fat before muscle, but when someone sits in a position or lies down in a position for too long, that fat is, imagine pushed aside, and then the skin makes contact eventually with the bone, and then the skin tears. And, bed sores could become infected and could ultimately lead to someone having to go to the hospital or death. Is the person for whom you're responsible, eloping or running away, opening the doors and kind of disappearing? That's also dangerous.
I love the way you put that, eloping.
Eloping. Has two meanings, one for marriage and one for escaping. But, that's another sign, the third sign. The other one is, are they presenting with dementia? And dementia, is a gradual onset, forgetting keys or forgetting that they left the TV on. But this may lead to a person forgetting to turn off the stove or the range.
Yeah, that's a tough one.
It is very tough, and so very dangerous. And there have been incidences over the years where homes have burned and
right. You
perished.
Hear it on the news and read it in the paper all the time.
And so falling, bed sores, eloping, signs of dementia, all elements where one might consider a nursing home. And there will come a time when we may have to put a loved one in a skilled nursing facility where they will be more safe and more comfortable than in their present setting. And also, they can interact with people their own age and spend time with them, talking about, their lives and their histories. And I think just psychologically, mentally, be, more stimulating as well.
Well, sure. I mean, for us, we get up every day and go to work, and we're around other people, and we feel a lot of gratification in the jobs that we do. And I know for myself, if I have a snow day and I'm just stuck in the house all day, I mean, there's only so much cleaning you can do. You just go stir crazy. You want to be around other people, like you said. So why wouldn't your adult in your life, the elder person you're caring for in your life, want to do the same thing? They, maybe they had a career and were very active and was out around people a lot. Now all of a sudden they're not. And that gets depressing.
Yes, it certainly does. And depression leads to other conditions as well. They may stay in bed too long. They may become asocial and so on and so forth. So it's always good to stimulate, the mind and the body. And, adult daycare centers provide that to a degree, But, like I said, when your loved one's needs begin to increase and your concerns begin to increase, and also, the costs begin to increase as well, such that you may be paying more for daily care for your loved one than would cost, for example, the cost of a licensed skilled nursing home, where they provide more than just oversight. They provide care. They provide licensed, certified professionals, the nurses, the certified nurses aides who provide the daily care, the dietary management. Everything is tailored. The foods are tailored to the needs of, the resident, whether it's a, low sugar diet or a low fat diet or low cholesterol diet or high starch or high protein diet or low protein diet, et cetera. Everybody's needs are different. The activities that they require, the physical activities, the mental stimulation, the involvement with community members who come in from the community on a daily basis to meet with the seniors. These are all, essential in helping that person recover faster, maybe leaving the facility or living out the remainder of their time in peace and happiness, dignity, safety, and comfort, and in good health. These are really, really critical elements in a person's golden years.
Absolutely. And now, how would you go about finding an adult daycare center in your area?
Well, I mean, the quickest...
I'm obviously asking around to your friends that you
Right.
would get a recommendation from, but
Right. I mean, there's several sources here, and the first one is flip to the Yellow Pages, look up at the adult daycare centers, and you'll find a list of them. Jot some down. Visit minimally 3 within 20 miles of your home, for example, so it's easy for you. Maybe on your way to work, you could drop someone off, see how many are en route to work, and stop in and visit them. But additionally, speak to your doctor and their staff. Doctors usually have, and the staff, in the doctor's office, have a list of referrals. Speak to friends and family members who may have actually been in an adult daycare center themselves or who referred ones to that. Speak to parishioners, speak to neighbors, and see what options you have. And as I said, visit at least 3 of them. And make sure you bring a list of questions. Stop in, maybe in a scheduled visit, but importantly, also stop in impromptu. Maybe on your way home one day, you stop in again, see what's going on. Make sure that the residents are involved and active and not just sitting in chairs or sofas and watching TV and just one person overseeing 20 or 30 or 40 or 50 people. See where their activities rooms are. See how many people are there participating. How many people are on staff, from morning until night. Ask these, basic questions. And again, I refer our listeners to our site, littlebrooknursingHome.com, littlebrooknursingHome.com, and look at one of the tabs which has a checklist, and it's a whole big checklist that applies not just to evaluating nursing homes, but evaluating any type of senior care facility, including adult daycare centers.
Great. Well, John, once again, very good information for everyone out there, no matter what your age is. And a thought just came into my head. We should have a senior daycare facility connected to a child care facility and join the two together.
Right. People who are of age are in their 30s, 40s, and 50s, and or 60s
You're dropping
and
off
70s.
your kid, and you're dropping off grandma.
Dropping off your grandchild and your child, and then dropping off grandma or an uncle or whomever, a friend or relative at a facility nearby. And as our population ages, we'll see more and more of these types of facilities coming, into our communities and providing, again, the basic services, the socialization services, and some of the basic health services that should not be a replacement for at-home care or hospital care or nursing home care. Because as I said earlier, people who are falling, have bed sores, are, eloping into the community or are becoming more and more forgetful and putting themselves and family members at risk, especially at nighttime, really should be considered for placement in a local skilled nursing home.
John Hampilos has been our guest this morning on Contours. He's from Little Brook Nursing and Convalescent Home, and they are in Califon, New Jersey. If you'd like more information on anything we've spoken about today in his newsletter, Adult Daycare, for those you care about, you can check out their website at littlebrooknursinghome.com. And again, thanks again.
Melanie, thank you very much.